thank Dr. Yahya and Professor Saad and the doctor who just presented me, Dr. Rahab. Thank you very much, Dr. Rahab, for the presentation. I'm just going to go without further delay. I'm just going to go. Go ahead and start talking about my presentation. Basically, I'm just going to give you a brief outline of maybe one of the suggested approaches on counseling preterm babies. This is the city hospital where I work, and that is here in Dubai. So my aim today is actually to just go quickly as a background on the counseling and how it's been guided internationally and nationally, and then to suggest a practical approach on how to do it. Going back a bit in history, not very far history, but it's only recent history. There isn't really much about counseling, and counseling perhaps stems from similar guidelines by the Royal College of Nurses. That's in children. That means, and surprisingly, there isn't really much guidance that's been issued available online. And this is just a definition of bad news, which the reason I'm talking about that is because counseling preterm babies' parents, it's mostly about really talking about not so good news, and the not so like change the way so talking to parents, we mentioned several guidelines. It's by the British Perinatal Association, and these guidelines that go back back in the history of 2008. And there is a good section about counseling. But then these guidelines will be created in 2019, based on three points. But in the executive summary, you can see just quickly the point 11 and 12, the last points, they're talking about the importance of counseling these parents and how to talk to them. Oops. Then if you go across the Atlantic, the Canadian Pediatric Society has actually updated the guidelines on counseling parents of preterm babies. And the latest version is actually in 2017. And it is clearly talking about counseling and approaching these parents and how to talk to them. Then if you again go down the border to the American Academy of Pediatrics in 2015, and that is the latest, there is some guidance on the counseling of parents of preterm babies. This is a very important issue, of course, and even in the newborn resuscitation protocols, you can see that the counseling is very highlighted in the protocol for resuscitation, both for NLS and NRP. So antenatal counseling is an important first step. Quickly, the skills that you need in order to conduct counseling, you need the verbal and nonverbal skills, meaning that it's not something that you just read in a book. You need to be trained to do this. And training should involve what to say, how to do it, and when and with whom, and who will train you to do it. There are several things that can go wrong, and I've just listed some of them. But if you look at the inadequate preparations is one of the important things. So if you go in without being trained, without being prepared, without knowing what to say, you are planning for a disaster, I guess. Miscommunication, poor delivery, it's all to do with the way you do things. Cultural and language barriers, these are very important, especially in our area here. So language is very important, knowing what to say, keeping in mind the cultural background of the parents is very important too. Sometimes the parents simply cannot hear you or cannot understand you. They have a hearing problem or they can't see you. So these are very, very unnoticed barriers to successful counseling. So this is where the strategy for counseling is coming from. So the strategy can help you in a way that it can increase your confidence because you have a plan in mind. So you're not going in a very, very unplanned way. And it does help the parents as well to take part in the discussion. And then you will be less stressed about it. If you go back in history in your career, when you are talking to parents, maybe in the first few years of your career, you can maybe recall how stressed out you were. And even now, I can tell you, I've been graduated for just over 30 years, 30 years, and I still get the excitement and sometimes the stress from talking to parents. So it's not really something that you master and you just do it smoothly. Protocols. Now I'm just going to tell you about protocols, and this is what is it all about today. There are, again, if you look at the literature, there are some protocols about breaking bad news, but there isn't actually a protocol about talking to parents of premature babies. So what I did, I looked back and I actually looked at what we could do, what we can do in order to suggest something for our trainees, for our colleagues, in order to make life easier for them. So I looked back and I looked at some of the suggested protocols, but there isn't really for preterms. They were originally planned for oncology. That's to break bad news. So our oncology colleagues, they've done better work in that front. And I can just list the most important ones in the literature. So I came across SPIKES protocol, and these are acronyms as to how the protocol is going to be conducted. And it's easier to remember, obviously, having an acronym for the protocol. So SPIKES protocol was devised in the year 2000 and actually in the year 2000. And then you have the A, B, C, D, E, and the breaks. They are more recent, especially the breaks was actually devised in the year 2010. But my choice actually, and my heart fell for the SPIKES protocol. So what I did, I approached the authors. Buckman, actually, he passed away, sadly, but I managed to speak to Bale, and he kindly gave his permission to use the SPIKES. I contacted him in order to actually modify the SPIKES protocol in order to be useful and usable for neonates and for counseling. So I called it modified SPIKES. And SPIKES, as you can see, it stands for S for setting up the interview. And I'll just briefly, in the coming few slides, go into details about this. And then P is assessing the parent's perception. I, invitation. K is knowledge and information to be given. And then E, it's about emotions, which is very important. And S, and it's last but not the least, it's about having a strategy and a summary to your consultation with the parents. These are the guys. This is Robert Buckman, who an Englishman who moved to the US, and he passed away sadly. But Walter Bale is a professor of psychology, and he used to be, I'm not sure if he's still the director of a well-known cancer center in the US, which is the MD Anderson Center. Our colleagues from the US probably are familiar with the place. This is his kind permission. So he said that kindly, please feel free to use it in your application. Good luck with your work. That was back in 2017, by the way. So just quickly going through the protocol. So setting up the interview, arrange for privacy, of course. Most of what we are going to say is you may think it's common sense, and it is common sense. But obviously, to have a plan, a good plan, is very important. So common sense doesn't come from nothing. It has to be planned. So setting the interview, privacy, involves significant others, meaning that in addition to parents, if you can manage to have the obstetrician or a family relative, if applicable, obviously with the permission of the parents. And then you need to make connections with parents and family. And then you need to make sure that this is done in a private place without interruptions, without your phone going off every now and then, given the seriousness of the situation. And again, I keep pressing on the button that goes, make the screen goes off. Sorry about this. I'm just going to show you, this is a quick clip of a video. I think it's maybe the only video that I'm aware of with real parents. So this is a video that I recorded in my own hospital. And this is just to give you a flavor of...
Hello. Hi.
Just an introduction.
I'm the neonatal consultant. My name is Dr. Zahreddin Abusalah, and I'm here to talk to you about your expected delivery of your preterm baby. Can I sit here and talk to you?
Of course, please.
Thank you. There you go. The reason I am here is to talk to you about your baby and her prematurity. This is a very important issue, and we always come and make sure that we talk to parents before the delivery happens, because there are some special issues that needs really to be discussed and you need to be aware of. I usually start talking to parents about their expected premature baby delivery by going through the major issues which are related to prematurity. If you have any question about your baby, even before I start talking, please feel free to ask. Otherwise, I will go through things and then you can stop me as I go along, or you can ask me at the end of my conversation.
So, Doctor, the one thing that we would be most anxious to know is what happens. How is she going to be okay?
P for the spikes, again, it's about parents' perception. So you have to actually explore parents' expectations and perceptions of the situation. And then you can then talk about all the aspects of prematurity and extreme prematurity. And then again, to take away all the unreal expectations that the parents may have about the expected birth of their baby. We are talking about antenatal counseling now. Parents' invitation, again, most of the parents, they will actually, they would like to know everything about premature babies, but some of them they may push away some of the information. They will not be interested in knowing much. And they obviously thinking about the upcoming delivery, about the cesarean section that are going to have. So you need to explore how much information these parents wanting of you. And you need to be smartly gauging how much of it that you will be providing or passing to them. Okay, knowledge and information to parents. I think you need to, again, you need to stick to medical facts, not in a medical jargon, in a simple, understandable language. But again, parents will really be very keen at this stage to know the outcomes. So you have to be equipped with the outcomes and the details about outcomes. Perhaps if you have local data, that would be ideal. If not, then international data will do. Outcomes, this is just a quick, really refresher of most of the data that we have available internationally about outcomes. So you really have to have because the parents, although I try and go away or move away from numbers, but at the same time, I would actually see that parents will be very, very interested in percentages and in numbers. So I think you should have some numbers in mind in order to give them. Unfortunately, here in the United Arab Emirates, we do not have much of a data of outcomes. I have some work on outcomes in our own locality about neurodevelopmental outcome at the age of 2 years. I do use it as a local data. This will need a different forum and a different presentation. Maybe I'll talk about it in the future. We do introduce Parker R now as a 2-year neurodevelopmental tool, and it's been published as well. So E is addressing parents' emotions. So this is probably the trickiest part of the affair. I think you need to be really aware of how sensitive the situation is. As you can see, you need to be able to be as empathic as you can. And also you need to be aware of how stressful the situation is. In the S, it's very important that you start very important. These are very important points.
My last point is that you are really most welcome to come and visit the neonatal intensive care unit if your condition allows, and we will show you around just to have an idea what is it like to be a parent in an NICU. And then we will see you at the time of birth. Okay? Thank you very much. Thanks.
Questions. Will my baby survive? I think it's a very, very important question that you will face, and you can see.
So, doctor, arriving at 28 weeks,
You can see how the facial expressions of the parents while they are talking about such a stressful and sensitive issue.
Although we try and not to talk about survival in great details at this stage, I know you are very worried at this stage and you are very anxious as well. I would like to say that survival has actually improved over the years with regard to premature babies, with all the advances in the neonatal care. If you are talking about your baby being born at 28 weeks, the survival rate has improved a lot. It is now at about 80%, maybe higher. And I'm sure every baby is different, and your baby is a different individual who will only prove her.
These are the parents of a 27-weeker, so that's why I quoted 80%. So these are just some facts that really, these numbers are taken from several international data. As I said, we don't have exactly local data to support this or disprove it. I've been campaigning to this modified spikes, and as you can see that I first presented it in Excellence in Pediatrics in 2016, then a Reasons conference in the UK. This one was in London, and then it was in University of Warwick. And then lately I did it in the European and Neonatal Ethics Conference in Southampton. But what made it really for me as a breakthrough, it was presented in the Royal College of Pediatrics Conference and published in 2020 as a modified spikes. And then I'm very proud of the fact that it's been used in the latest scoping review of counseling of preterm babies paper that's been published lately in 2021. And you can see that's been one of the 42 papers talking about approaches to counseling. Are we getting better at it? And that is maybe the main question. The answer is not really. So these are just papers about 4 or 5 years ago talking about how we are not doing it in the right way, or at least we are not improving very much. This is another paper talking about practices that's been reported by questionnaire. But you can see just quickly that 53% did not provide any written information, for example, parents. 40% were not documented, these consultations. 45% of those who've been approached, they did not mention any statistics related to mortality. So basically, you can see that there's a lot of work that needs to be done. And what is next? I think we should probably follow the Dutch experience. This is a recent paper, 2019 in pediatrics, and it's talking about Netherlands nationwide approach for counseling. They made a panel of about 21 people, neonatologists, obstetricians, and parents, and they came up with a nationwide protocol as to how to conduct counseling in the Netherlands as a standardized practice. And I think perhaps we should adopt that locally, and maybe we will. My next step is actually we have a residency program in Dubai. The neonatal residency are shared between us and between Latifa Hospital. So I may actually, not may, but we'll be going ahead, inshallah, very soon in order to try and see if we can introduce this as part of the training and then to try and validate it as part of a standard approach. I'm going to end up by a quote from the American Medical Association, first code of medical ethics, and that was back in 1847. And you can see that the counseling and how this is done in a perfect way can help to maximize the good effect of this on you and your parents and your baby's outcome. If you remember, your babies that you've looked after, the preterm babies that you looked after maybe 10, 15, 20 years ago, and they still send me messages on the birthday of these babies, the parents. They do not actually remember how heroic I was in intubating, on doing UVCs and UACs and treating these babies, but they remember my words. Whenever they talk to me, they say, oh, I remember what you said to me that night when you told me about what is going to happen and what I'm going to face. So I'm just saying this for you to not to underestimate the importance of counseling and the importance of doing it right and the importance of saying it right. Actually, history goes beyond and before, well before the 1847, the Medical Ethics of American Academy of Pediatrics. This is a verse from Quran 1500 years ago. قول معروف وصدقة خير قول معروف ومغفرة خير من صدقة يتبعها أذى والله غني حليم. This is the translation in English. So there's more than one occasion where these are emphasized in our heritage and strongly emphasized in hadith and in verses of Quran. And it's really very important to use this also as a reference. In conclusion, there is no international consensus yet about how to conduct counseling, although there are regional limited attempts at doing that. I think modified spikes is the way forward. I'm marketing for it now. It's your way forward to do a systemic way of counseling. And the need for adequate and formal training is increasingly recognized. Special thanks to Mr. and Mrs. Knox, Lily's parents. Lily's now about 6 years or 5 years, 7 years. She actually relocated back to the UK. They are from Scotland. And I would like to thank Professor Bale for his kind permission to use his work and modify it to be used for preterm babies counseling, and also multimedia department for filming the video. The video actually is not available on YouTube. I'm not very good with social media, so I think I'm gonna sell it to you. But it's the only video that I'm aware of with I think I need some work. I need your help. I'm going to talk to you later. So I believe it's the only video with real parents that is existing so far. Thank you so much. That's my email.